I'm Liv Dummit, and I will be conducting interviews.
I'm Samantha Davis. I'll be talking about ways drugs and alcohol affect our brain and liver.
I'm Kayla Anderson, and today I'll be discussing how drugs and alcohol affect the heart, the lungs, and the fetus during pregnancy.
Usually once or twice a week.
I've never drank before.
At least 4 times a week. Like 4 days a week.
Once a week, if that.
Like once every 2 weeks.
Like once a week.
I choose not to drink.
Not very much.
Twice a month.
My name is Lori Mango. I'm the case manager at Hope Hill Youth Services in Mount Sterling, which basically means that I handle everything related to all of our residents' cases except for their weekly therapy session.
Okay, so do you have teens that have drug and alcohol abuse?
Yes, we have many young ladies in our program. They're all between the ages of 12 and 17, and I would say about a third of our population comes in with one of their presenting issues being substance abuse.
So how do they act when they come in compared to when they leave?
When they first arrive at our placement, it's a very rough transition. We have a lot of ladies that, as of late, have been addicted to methamphetamines, and the process of adjusting back into a normal milieu without their drugs is very rough. They are aggressive and agitated. They either don't sleep very well at all or they want to sleep way too much. Their appetites are affected. A lot of times they're incredibly underweight when they have an amphetamine addiction, and so they'll come in and they'll put on a lot of weight really quickly, which is really just getting to a healthy place. But that presents a lot of other issues with self-esteem, and they're used to living a certain way and needing certain things or not. And when they come in, just kind of getting back to normal life and what is good for their body and what's good for their mind is really hard.
The side effects of alcohol are slurred speech, vomiting, drowsiness, diarrhea, loss of consciousness, upset stomach, headaches, and difficulty breathing.
I'm talking about the liver. The liver breaks down the drug and slowly neutralizes the effect it has on the body. Prolonged and excessive consumption of alcohol will result in liver damage and could possibly lead to cirrhosis of the liver, which can be fatal. This is a liver that someone has been drinking for 40 plus years. They actually have cirrhosis. Alcohol and drugs have a big effect on our brain. The faster the drug reaches the brain, the more intense the effects. The fastest and most dangerous way to use drugs is to inject intravenously. The slowest route is to eat or drink the drug. Ecstasy appears to affect serotonin. Serotonin is a hormone in the brain. Prolonged use can cause people to be chronically depressed. This is the brain of a healthy person, and as you can see, the yellow parts are high activity, and this is someone that's a cocaine abuser, and there's not as much activity at all.
Drugs and alcohol affect the heart in many ways. Blood containing the drug is what affects how people feel. Drinking too much alcohol can weaken the heart's ability to pump the blood, which can cause heart failure. And light to moderate consumption of alcohol is better than none at all. And this is what a heart looks like, that somebody who has been smoking cigarettes, and it creates plaque in the arteries, which can cause a heart attack, which can lead to death. Drugs can affect the lungs in many ways. Drugs can get absorbed into the lungs in 8 seconds. Insufflation is where you take a fine spray and you rapidly inhale it into your lungs. If done wrong, it can lead to suffocation and clogging of the bronchioles, and also cause permanent lung damage. Every method of drug use, no matter if it's insufflation, intravenously, it is still harmful to your body. Drugs that are smoked is cannabis, cocaine, crack, ecstasy, heroin, ice, and methamphetamines. Drugs that are inhaled are poppers and nitrous oxide. This is a pair of lungs. This is of a healthy person's lungs, a person that doesn't smoke. This one is a lung that has a person who has smoked for 30 years, and you can see all the lung damage is in the black. drugs affect pregnancy in numerous ways. The drugs are given to the baby through the bloodstream. Although malformations are rare, there are still some cases that malformations of the baby have occurred with drug use. Heavy consumption of alcohol, heroin, opiates, and tranquilizers can lead to premature birth, low birth weight, and increased risk of losing the baby closer to the time of birth. Babies can experience withdrawal symptoms if the mother is addicted to a certain drug while pregnant with kid. And suddenly stopping the drugs can be harmful to the baby and the mother. This is a baby with fetal alcohol syndrome, and fetal alcohol syndrome is when the mother consumes too much alcohol while pregnant, and symptoms are small eye openings, a smooth philtrum, and a thin upper lip.
I don't want to drink anymore.
It helps reinforce the reasons behind why I don't drink and just makes me want to never drink.
Probably like a couple times a year.
It doesn't change anything.